Very good morning, everybody. Today I will explain about the unilateral cover test in detail. In my previous video, the introduction about cover test and the principle of cover test. So, by means of doing unilateral cover test, we actually detect the presence of strabismus or tropia, the manifest deviation of the eyes. So, for doing the unilateral cover test, the prerequisites are: first, we instruct the patient to wear his full refractive correction, either spectacle or contact lenses. Number two, we or the examiner sits in front of the patient and in such a way that the examiner's head does not block the viewing path of the patient and the distance visual acuity chart. And we ask the patient to look at the distance acuity chart, and the target acuity is the one line above the patient's best corrected visual acuity. So let's suppose the patient's corrected vision is 6 by 6, so the target acuity is 6/9. Okay, and the examination is done at normal room illumination, and the examiner then covers one eye at a time and look for any movement occurs in the uncovered eye. And this is unilateral cover test, means the one eye is covered at a time. But the question is, why there is occurrence of movement in the uncovered eye? As because when we break the fusion by means of cover test, if there is presence of any strabismus or tropia, the uncovered eye will take the fixation. So for taking the fixation, there is movement. Okay, so this is the procedure. And what is the interpretation? Let me give an example. Suppose here I am the patient and I am also the examiner. So I covered my right eye and there is no movement is showing in the uncovered or left eye. It indicates that the left eye does not have any tropia, or there may be presence of any tropia in my right eye. Now I will cover my left eye, and this uncovered or this right eye shows movement. Now remember that when this, after covering left eye, when this right eye is showing the outward movement, the patient has esotropia, and when the right eye showing inward movement, the patient has exotropia. Okay, so don't forget that when the eye moves outwards, the patient has esotropia, and when the eye moves inward, the patient has exotropia. Okay, uh, this is all about the unilateral cover tests. Thank you for viewing. For the details about the alternating cover test, see my next videos.